Well, we've got a very special speaker today, and I'm going to embarrass him, but it's all true. Now, you can read about the wonderful achievements of our professor in the flyer, but I'm going to give you a more personal touch. So before I joined the foundation in 2014, thanks to a bequest, we had the opportunity to scour the world to get a real star to come to Western Australia, a doctor with a very strong research interest. Now, I wasn't involved, but I've heard that the wish list or the need list was pretty long, and I'll give you some of the things. The first one was, of course, an excellent doctor to give the very best clinical treatment in Royal Perth Hospital, and to earn and keep the respect of his colleagues, and to set standards, making sure we're always totally up to date. The second was to be a first-rate researcher, doing research that's relevant to West Australia and the lives of all West Australians, to be at the top of their field internationally. Now, one of the ways that people show that is something called an H factor. I don't know what H stands for, but certainly some people brag and some wish they had a better H factor. The nearest I can get to is, I guess for a cricketer, it would be their batting average. Now, our professor has a very good batting average, I have to tell you, but we wanted one more thing, and that was leadership, because starting from scratch, we wanted to build within the hospital and the foundation a fantastic group of researchers, both training our young scientists, but also training our doctors to have an appreciation and understanding of research, to build it into their lives. My gosh, they ticked every single box. And I know you're embarrassed, but it's all true. But I'll give you a wonderful example. So last year, the foundation introduced a new award. It's the Mentorship Award. And the people who are nominated are not consulted. It's the younger ones who've been receiving mentorship who can write in and recommend someone to win the award. Well, we can see who won the inaugural award. So not only are you appreciated by the foundation, you're appreciated by all your team. We just are really thrilled to have Professor Markus Schlaich with us today. He's going to talk about metabolic syndrome, which is a sort of cluster of conditions. I'm longing to hear more about it. It's been a bit controversial in the past, but it's a very real condition. And one aspect of that is blood pressure. And those of you who've been kind enough to have your blood pressure measured today, some of you might have done so at one of our previous events. Anybody a returnee who's had their blood pressure measured before? Well, if you had been, your data is now in an international journal that's going to be published just in a few days' time to give us a scorecard of where we're going and how to make sure we give people a healthier life. Let me introduce Professor Markus Schlaich.
Thanks so much, Lynn. Thank you so much for your kind introduction, and welcome everybody. I think I'm blushing a bit after hearing all of this, but fabulous to be here today, and it's a great pleasure to give these kinds of presentations. Usually we present at large scientific meetings, and that is important to get the latest research out there, share it with colleagues to advance medicine in general. But we rely very much on people who volunteer for research purposes. And I feel we also have to give back to people and help to educate them on very important topics. And before I start, may I ask, who of you has previously heard about metabolic syndrome? Does it mean anything to you? So a few people, but not too many. And Lynn already mentioned it has been a bit of a controversial syndrome. Whenever doctors use the term syndrome, they're not entirely sure actually what it's all about. And in this instance, it's a bit of a cluster of risk factors brought together to determine the risk of people in terms of adverse health outcomes, and usually cardiovascular disease. So this is what we're going to cover today. Welcome again, and I'll just start with this slide. As Lynn also mentioned, I'm not originally from Australia, as you can hear from my funny accent. I'm originally from Germany, but came to Australia back in 2006, and I'm a trained nephrologist, so I specialized in kidney disease, and with that often we deal with high blood pressure, so this is my specific interest, and I had all my training, or most of my training, in Germany, here in the southeastern part of Germany, beautiful spot, but then came to Melbourne, the Baker Heart and Diabetes Institute, before I had the great pleasure to join the Royal Perth Hospital Research Foundation, the Royal Perth Hospital and University of Western Australia, with the inaugural Dobney Chair in clinical research. And what that means is really to do hopefully good medicine, treat people in and outside the hospital, do good research, but also very importantly, and Lynn mentioned that, is to foster the next generation of clinicians and researchers, and that's extremely important. And I was probably one of the proudest moments was the mentorship award, because that really means a lot and hopefully indicates that this is one of the things we really have on our agenda to make sure that the colleagues tomorrow are doing a very good job. So here we are, and interestingly, and that still happens to me at times, when I meet a new person, I see they look at me and they say, "You remind me of someone, you remind me of someone." And all of a sudden it comes to them, "Oh yes, you remind me of Arnold Schwarzenegger." And it's actually a true story. When I heard myself on an answering machine, your voice sounds very different when, compared to when you hear yourself speaking. So I was very proud of that comparison, because I thought that person felt similar to Arnold Schwarzenegger because of my body build. So I had a smile on my face. I drove home, and in the car I realized, gee, I didn't have a look in the mirror for a very long time. And then I got home, I got undressed, and what I saw was this. And all of a sudden I realized it wasn't really my body build, it was my funny accent that reminded him of Arnold. But he's from Austria, I'm from Germany, so there's a slight difference there. But actually that leads us into the metabolic syndrome. Who do you think, who of these two people is probably the healthier one? Assuming Arnold did not use steroids to get all his muscles. Looking at the pictures, who would you think is metabolically perhaps the healthier person? Arnold, most likely, yes. So, I mean, this is a reasonably lean chap. He's got perhaps a bit of a belly, and we come to talk about that. Abdominal obesity, or accumulation of adipose tissue or fat around the belly, is quite dangerous. You may have seen those adverts on TV from the Heart Foundation, where a worker stands at the petrol station and he sees all the beautiful pies and everything in the little shelf, and then he sees his own belly and how the fat works and causes a lot of issues. And that's what we're talking about, metabolic syndrome in a sense. So the invitation kind of already gives you the summary of the talk, and I mentioned that syndromes are usually an accumulation of certain risk factors or parameters that we put together. And in this instance, this is excess body weight or excess adipose tissue, usually referred to as visceral obesity. Visceral means it's the fat around the inner organs, which is the toxic kind of fat, if you wish. Not so much the fat around your thighs, for example. So it's really the one around the abdominal organs. It's the elevation of blood pressure, or hypertension as we refer to it. It is glucose metabolism, an increased level of glucose, often leading ultimately to the development of diabetes, type 2 diabetes specifically, and its alteration of lipids. And the specific aspects for this syndrome are high triglycerides. That's a certain part of the lipid fraction, a certain part of the cholesterol we're measuring, and low levels of the good cholesterol, the so-called HDL, or high density lipoprotein cholesterol. So, and you can imagine the concept of the metabolic syndrome is essentially, if you have any of these risk factors at a very high level, let's say your blood pressure is, a normal blood pressure is below 120, let's say your blood pressure is 180 systolic. This is dangerous and you need to do something about it. And everybody understands this. But the metabolic syndrome brings together these risk factors, but they're usually just slightly elevated, but not just one, but most of them. And if you have 3 of these 5 risk factors or elevations in those parameters, that gives you the diagnosis, if you wish, of the metabolic syndrome. And it is associated with increased risk of adverse health outcomes such as heart attacks, strokes, kidney problems, heart failure, etc. So that's the general concept. And let me put that into perspective, why that is important and why this kind of syndrome was established as a diagnostic tool, predominantly actually to help doctors to recognize this. Because often we think, well, your blood pressure is slightly bit above, that won't matter too much. Your glucose is a bit elevated, your cholesterol is a bit high. And we could look at those individually and say, look, it's not much of a problem. But if they all come together and everything is a bit elevated, that's when you get an additive effect and you have this increase in risk. And now if you look at this graph, it highlights the causes of deaths across the globe summarized in 2017. And the factors we're talking about today, high BMI, body mass index, a measure of overweight and obesity, I'll come to that in a minute, high blood glucose, the precursor of diabetes, and high blood pressure. So 3 very important factors here are responsible for a huge number of deaths every year. They're directly responsible. And you can imagine if all of these 3 come together, the risk for an individual is significantly increased. That, of course, doesn't mean that there's not other risk factors. Smoking is still a very important one, as we know. But for today, we're focusing on these ones. So this is a global view. But what does it look like in Australia? This is a summary which highlights that high blood pressure is the single biggest killer in the world, but also in Australia. So these are the cardiovascular deaths in Australia that are attributable to specific risk factors. And you see high blood pressure, dietary risks, so bad diets, increased glucose, excess body weight, high body mass index, and high cholesterol levels, low physical activity. They together account for the largest part of that burden. And therapeutically, obviously, it makes perfect sense to try to target that and target it early. Because the earlier you intervene, the more likely you don't get to that stage where it causes some problems. And I'm going to show you what the problems may look like in this instance. So this is the concept of cardio, which is the heart, and metabolic is everything to do with how our body deals with food, in particular glucose and lipids. Cardiometabolic risk. And of course, there's a range of other factors that come into play. Genetics, for example. A lot of conditions run in families, and there's not much we can do about it. That's just a fact. In the future, we may be able to alter our genetic makeup to some extent. It's already possible, in some conditions, but that's not going to be the mainstay. We all increase our age, of course, over time, so not really much we can do about those factors. But others, such physical inactivities, smoking, unhealthy eating, this is where you can have a huge impact on your own health. And we're going to talk about some aspects of that in a moment. But again, highlighting why the metabolic syndrome was introduced, those 5 factors that constitute the metabolic syndrome, overweight or obesity, elevated glucose, elevated blood pressure or hypertension, and abnormalities in the lipid or cholesterol profile. Again, very important players, not the only one, but this is why we need to address them. Lynn mentioned there was a bit of controversy about this, and the world experts actually came together to harmonize that concept. You can imagine if something is new, all the experts across the globe, they have their own ideas, and it's often scientifically very difficult to bring them all together and come up with a universal definition. But this is crucial, so no matter where in the world we talk about this, we talk about the same thing. And what they actually came up with, just to give you a bit of an idea about the levels we're talking about, if you have 3 out of 5 criteria, you are diagnosed with a metabolic syndrome. And this is if your triglycerides are above 1.7 millimoles. Some of you may have had their lipids tested, most of you probably. If the HDL, the good cholesterol, is below 1, if the blood pressure is above 130, and that's not very high. This is not really very high blood pressure, but again, it accounts for the concept that a bit elevation everywhere contributes to this high risk, and a glucose level here above 100 milligrams per deciliter, which is above 6 millimoles roughly. So that's kind of the definition, and this is what we as clinicians work with. What you then often see in the public press is something like this. What is the deadliest metabolic syndrome triad? And so which 3 of these 5 factors are perhaps the most important if we look at them individually? And it turned out that obesity, high blood pressure, and the high glucose are the main drivers of this if you think about it in cardiovascular risk or cardiometabolic risk terms. And they tend to show, of course, a very nice picture, but that kind of highlights the problem in a sense, abdominal obesity or increased waist circumference. So I will focus a bit on obesity, which often gives rise to all the other problems. And that's why this is probably the most important factor which we can target. And unfortunately, these days, we also see much higher rates of overweight and obesity in young children, in adolescents. And we may think, well, is that really a problem? It is, absolutely. And I'm going to show you some data which relate the increase in body weight in adolescence or childhood to outcomes later in life. Before we move on to that, just wanted to clarify what we actually mean with body mass index. So this is a common measure of overweight and obesity. What it takes into account, obviously, some of us are tall, others are smaller, and that does play a role. You could be 2 meters high and have a weight of 100 kilograms, and your body mass index is probably perfectly fine. But if you've got the same weight and you're only 150 centimeters, that makes a huge difference. And that goes into this body mass index. It is essentially your weight divided by your height to the square. So if you're 150 centimeter, let's say it's 1.5 to the square, and that gives you the body mass index. And normal is what we consider here is between usually 20 to 25 roughly, and then in 5-point increments we get to overweight, 25 to 30, class 1, 3, 2 and 3, obesity, and this is what we refer to as morbid obesity. This is when people really may have trouble moving even. It's very hard to get them sometimes to a hospital. You need specific beds to ensure these patients are safe. So this very, very high level of obesity is a big problem. And what does it look like over the globe? And again, it is a true pandemic. Of course, we know very well by now what a pandemic means. We have been extremely lucky here in Australia in general, specifically in Western Australia. And it's still very important to also consider the other pandemics we're facing. And of course, they're not on the news constantly, but they're working in the background. And this is the trajectory of the percentage of patients in a number of selected countries in the world. And it doesn't matter where you look, there is unfortunately an upward trajectory. So overweight, obesity is increasing essentially in any of those countries highlighted here, just USA, Australia, Spain, England, Canada, but you could essentially put any country on that map, including, and that may be a bit surprising, developing countries in Africa. And why is that? Well, junk food is available now. It's cheap even in those countries, and since the introduction of that, you see a very nice association with the rates of overweight and obesity. So it really comes down to a good, healthy diet, and that is perhaps best proof that there's a clear link, and that is depicted here. Now, for Australia, you see a similar trend. This is forecasted up to 2025, and whether you look at males or females doesn't really matter. There's an increase in the percentage, and the other thing that is a bit scary, overweight, we see quite a lot of people who have just a bit of excess weight, and that's perhaps not quite as severe as if you have much more on board. And the contribution or the percentage of those with true obesity is increasing. So we're creating more problems, and the consequences of obesity is unfortunately what we often see in the hospitals and the clinic, which we have to deal with. And I'm going to show you what those consequences actually are. The really scary part is this one. This is the trajectory and proportion of overweight and obesity in Australian children and adolescents. So the cohort here was between 5 and 19 years of age. And again, predicted to 2025. This is just not acceptable. We have to do something about it, because these adolescents, they're going to develop type 2 diabetes earlier. They're going to have severe high blood pressure. They're going to get heart attacks, strokes much earlier, instead of perhaps 60, 70-year-olds where we see this most commonly. We may get 40 and 50-year-olds. So, the problem is getting bigger and affecting larger parts of the population. And again, you may ask, well, look, if I look around, we see, quite a lot of overweight, perhaps obese people out there. Well, this is almost normal to us. Does it really make a difference? Absolutely. And this is a paper from the New England Journal of Medicine, considered probably the best or the highest quality scientific journal in the world. And what they published there is they looked at body mass index in children and adolescents, and then followed these patients up to see how do they fare down the track. And very clearly, those ones with the higher body mass index were the ones who developed cardiovascular disease in mid-adulthood, so around the 40s, 45 years of age. So a very clear-cut association. So we have to interfere early, and there's a number of good initiatives where in kindy and in preschool, they are being taught now what is good food, what to drink, avoid soft drinks, etc. So we're starting there, but there's certainly much more we have to do to avoid that next pandemic, or actually we are already in the pandemic in that context. The future is already here. Mankind has developed amazingly over the years, as you can see here, but unfortunately it seems we're taking a step back now and going the wrong direction, and we have to do something about it. So what is it we can do? And that's what I want to cover in the next few minutes. But before we get there, just really, as I mentioned earlier, would like to showcase a bit all the various complications that are very frequently associated with excess body weight. And this is just a selection, but essentially, if you want to take a very simple message, with overweight and obesity, virtually everything gets worse. And that relates, for example, here to cardiovascular disease. I'll talk a bit more about that. This is high blood pressure, heart disease, and others. Sleep is often affected. A lot of these patients, due to their significant excess body weight, have so-called sleep apnea. We had a wonderful summit in the Pilbara around sleep and how it influences our health. Extremely important. We learn more and more. A good sleep is absolutely crucial. But people who are often who are obese tend to have sleep apnea, which disrupts their sleep. They feel very exhausted, and you can imagine the impact it can have both physically but also on their mental health. The kidneys are quite susceptible to changes in body weight, if you wish, and there are specific conditions that are associated with. Obviously, as I mentioned a few times, overweight or obesity, they really are the precursor of the development of type 2 diabetes, essentially meaning that the body can't really cope with the glucose that is produced, and the organs that usually take up the glucose aren't capable of doing so, and that usually becomes worse the bigger the person gets. And then you need medication, you need perhaps insulin. All medications comes with side effects, so it's a bit of a vicious cycle. What's the one thing that works if you manage to lose weight? And that's again almost a universal kind of message. Try to achieve a healthy body weight as much as possible. And there's issues, of course, there, we'll come to that. But that is really crucial for those ones. Cognitive impairment and depression, mental health is also affected by that. We don't have time to go into that. Cancer, virtually every single cancer out there, you have a higher chance of getting it, and you have a higher chance of having a worse outcome if you're overweight or obese. And again, there's commercials on TV. You may have seen those where a surgeon, removes, an organ and highlights, obesity and smoking in that context are the real issues. And the list continues. But let me just again highlight those important ones: the risks of overweight and obesity, high blood pressure, type 2 diabetes, liver disease. Obviously, the liver has to deal with a lot of glucose and lipids that come its way, and it takes damage. The kidneys take damage, the lungs, but also your joints, for example, osteoarthritis. Your joints have to carry a lot of more weight. So every part of health is usually affected by that, and there's a simple cure, if you wish, and that is trying to lose some weight. Just a few other examples. This highlights, the more parameters or the more criteria of the metabolic syndrome you have, 0, 1, 2, 3, 4, 5, the higher your risk of developing kidney disease. So if you just have one risk factor, if you're mildly overweight or obese, that probably won't make all that much of an issue. But if you have all 5 factors, you have a significantly increased risk of developing chronic kidney disease, 245% higher than if you had a normal, or if these factors were normal. Just highlighting this in this context. I mentioned already obstructive sleep apnea. What that actually means is when a patient, or a person rather, is asleep, usually most people sleep on their back, and the airways are obstructed, and obviously there's no oxygen flow. Luckily, the brain will send signals, and these patients or people will have arousals and then start breathing again. Otherwise, they would obviously pass. But this is much more common in people who are overweight and obese. And some of the studies we are doing where we can look at the activity of a certain part of the nervous system, which is highly active during these phases of sleep apnea, and really control blood pressure. These patients have huge surges of blood pressure during day and night time, and that contributes to the risk they're exposed to. So you see that a lot of these things are significantly interrelated, and but that gives us an opportunity to intervene therapeutically. One of the common approaches to treat sleep apnea is so-called a CPAP therapy, continuous positive airway pressure, where people tend to wear a mask, and there's a positive pressure which kind of keeps the airways open. Obviously not always the most comfortable thing to wear. People, of course, move around, and it's not for everyone, but it's one of the ways of dealing with that. That's my other message. If people have problems, medical research is doing really great in many of these areas, and there's always something available. So what we need you to do is actually to discuss that with your health professionals, see what is available, and I'm going to show you a few of those therapeutic aspects. Last example I wanted to give, which is not very well known, even in the brain, high body weight can cause a problem. This is a condition called pseudo-tumor cerebri. What that means is these patients or people present as if they had a large tumor in their brain. They have blurry vision, and the papilla, which is the site where all the vessels come out, is extremely swollen. They have severe headaches and very difficult to treat, but that's one of those conditions that can be associated with the risk factors we see. These are retinal images. So this is the back of your eye, essentially, which probably most of you have been with an ophthalmologist or an optometrist to have glasses fitted, etc. And very often they do these images of the back of the eye. We do it for research purposes, to look at these blood vessels at the back, which tell us, perhaps how high the blood pressure was and other factors. Yes, please.
Is that migraine or is that?
No, this is very different to a migraine. This is quite a rare, luckily. The symptoms can be the same, but this is a very specific entity as such. Not very common, but really just wanted to highlight, all the things. It's a huge kind of a spectrum that can be triggered by those problems. So how do we deal with it? And I thought, well, I can give you what you probably heard many times, what is out there in the lay press. What I thought, I'll give you a bit of insight what we as doctors used to get or are getting from our colleges, how we should approach this. How can we help the community in taking care of this problem? And we've got this concept of the 5 A's. So this is how we manage overweight and obesity. And this is ask and assess. And that's exactly what I was just saying now. We have to communicate. If you have issues, you have to let your health practitioner know. They usually don't have all that much time, but if there's an issue, let them know and then it can be discussed. Then you obviously assess the problem. They may take blood tests, they may take urine tests, but obviously what they also would do is take your weight, take your height, get an idea where you are sitting, and then take the appropriate approaches. You should be advised, what you can do about a healthy diet. Stop smoking if you smoke. Alcohol really in moderation, and most people know about these, but that's the task we have to do. And then this is the biggest one: we have to assist and arrange approaches to revert the trajectory people may be on. And indeed, we have quite a large armamentarium of tools and therapies that we can use. And you may not necessarily know about it, and this is why you have to ask your GP or health professional for help in this context. The simple one, obviously, is lifestyle modification. I'm sure you all heard about it. Physical activity is very important. Now, physical activity often does not lead to weight loss. But what it does, it kind of exchanges healthy muscle tissue versus adipose or fat tissue, and thereby people become metabolically more healthy. Muscle is the most important organ in terms of taking up glucose from the circulation. And we come back to Arnold Schwarzenegger and the actor from Notting Hill, if you remember that image. Arnold has huge muscles, so those muscles need glucose. They suck it in. He, 100% will not have diabetes, except if there's a genetic predisposition for that. Weight control, a good diet, very important. And again, at the Royal Perth Hospital Research Foundation, we have an extremely good group of people who work on dietary approaches. They have taught us that apples, for example, contain a lot of, or vegetables in general, contain a lot of good chemicals that help us to live healthier. Obviously, you shouldn't smoke, and you should only drink alcohol in moderation. Now, if that is not sufficient, and that's not easy to achieve, I guess everybody who has ever tried to lose a bit of weight know how frustrating it can be. It's not an easy task, and it's not a sprint, it's a marathon. It doesn't, you can lose quite a bit of weight over a short period of time. It's extremely hard, though, to maintain. And this is where you need a partner, a dietitian or a GP or whoever, a health professional specializing in this area. If this doesn't work, again, there is medication available. There's a number of drugs, and we don't have time to go into detail. All I wanted to show you is that these medications that are around, Orlistat is perhaps a medication some may have heard about, metformin, usually used for diabetes anyway, phentermine, and you see on average, if you look at larger populations who use these medications, you usually achieve around 3 kilograms of weight loss. That may not seem huge, but of course it depends on where you start from. If you're 200 kilograms and you lose 3, probably won't make all that much of a difference, but everything counts. So, and there's more of those medications. Some of them are now being used in diabetes, and there's also surgical approaches, and we're not necessarily, this is not going to be the first step, but there's lifestyle, there's medication, and if things don't work, there's options. And really my message is you have to discuss it with your health professional. They would then look at you and discuss with you what may be the best approach for an individual. This is not a one-fits-all approach, and not everybody would like to have surgery. Some are very keen on that, but it has to be appropriately assessed to find what is the best approach for you as an individual. The most common surgeries that are being done, this is the one that is reversible, the so-called gastric banding, where you put a little band around a certain part of the esophagus or stomach here, and it just lets less food through. You're perhaps not as hungry, and it can be adjusted as required. And then there's something that is quite commonly done here in Perth, so-called sleeve gastrectomy. So you essentially remove parts of the stomach. That means there's less room essentially available, and the stomach and the gut do produce certain hormones that also play a role in why this often leads to significant weight reduction and other types of surgery. So this is a possibility, but of course, as I say, this doesn't fit everybody. So individualization is important in that context, and this is why you need to work with your health professional. The last few minutes I would like to talk about elevated blood pressure, and that was the second point, the second very important contributor to this metabolic syndrome. And again, very similar, obesity in itself or overweight is a very important contributor to elevated blood pressure. If we today measured all Australians and get their blood pressure, in 70% of those with elevated blood pressure, we would see increased body weight. So around 70% of all the high blood pressure we see is directly associated with overweight and obesity. So one kind of results in the other. Again, genetic factors play a role, but what we really can work on is the environmental factors, and they're very much the same as we've discussed for overweight and obesity. Inactivity, try to reduce your stress if you can, reduce your weight, don't smoke, don't drink, and adhere to a lower salt diet. Salt is quite important in the context of elevated blood pressure, so quite a few things you can do. This is the same message, just highlighted graphically. Reduce the salt intake, alcohol in moderation. These are the things we can work on. Some of them we can't, and that's gender, family history, etc. When I was in Melbourne, I had a patient who owned a winery, and obviously if you own a winery, there's no way around of having a glass of wine here and there. So we agreed, and I told him, okay, look, you've got a whole range of risk factors, we have to put you on some medication, but you have to promise me not more than one glass. I thought that was a fair compromise. And he left the clinic, my office, with a bit of a smile. Then he sent me this picture later on. Yes, I listened to you. I'm only having one glass a day. I hope that is okay. So, it depends, of course, on how you define a glass, but we have to be honest with each other, I guess. So, elevated blood pressure or hypertension, which is kind of the medical term for it, is extremely common. One third of the adult population, not only in Australia, but essentially globally, and this is the data here, no matter what region you look at, Africa, Americas, Europe, males or females, between 30 and 40% of the adult population have unhealthy or elevated blood pressure. So if we count it through here now, a third of us will have elevated blood pressure. And if you don't know your numbers, please take the opportunity afterwards. My colleagues will be available to have your blood pressure measured if you don't have it done. High blood pressure is really a bit of a problem because, fortunately or unfortunately, often it doesn't cause symptoms. A lot of people who I see with very high blood pressure feel perfectly fine. They're active, they're doing all the right things perhaps, and the blood pressure may be very high. Some have headaches, a bit of ear ringing, sometimes feel a bit dizzy, lightheaded, but all quite unspecific symptoms that could be due to a whole range of different factors. Only way to find out is to measure your blood pressure. No way around it. So again, take the opportunity if you can. And why are we really recommending that you know your numbers? Because, as I mentioned earlier, as you've seen on the slide, it is the biggest killer worldwide. High blood pressure is the biggest risk factor for strokes. Around 55% of all strokes are directly related to elevated blood pressure. So wouldn't that be easy just to lower blood pressure and we could get rid of half of the strokes we see? Every 10 minutes while we're sitting here, a stroke happens in Australia. So we spend an hour together, 6 people unfortunately will have suffered a stroke, and there would have been a chance probably to prevent this. Also very important in regards to the heart, so heart attacks, heart failure, very closely related with high blood pressure, and the kidneys and the peripheral arteries. So blood pressure extremely important to monitor. What can we do about it? We come back to lifestyle. It's really the single most important and most effective approach. Live a healthy life. Keep your weight as normal as possible. Be active no matter what, if you can. If you have massive joint problems and can't walk, that is very difficult, but you could go swimming, for example, if that works. So there are options, opportunities. Reduce your dietary salt intake. And again, we talked about alcohol before, and don't start smoking. Know your numbers. You've seen similar machines out there. Can I ask, is anybody here who has a blood pressure machine at home who measures their blood pressure? Fantastic. All right. Beautiful. Look, I really love to see this, because this is one thing we are very much promoting as well. Take charge, take care of yourself, have a little machine. They're not very expensive anymore. For $100, $150, you get very good machines. The ones we have out there are around $120. What you need to know is to measure it appropriately and accurately. And that usually means you have to sit comfortably in a chair with your back supported, have your legs on the ground. Don't cross your legs, because if you cross your legs, you restrict blood flow, and that will raise blood pressure. So that may give you a false positive. Your blood pressure may usually be quite normal, but it's just elevated because you cross your legs. So be aware of those things. Have the arm rested on a table. Ideally, have the cuff nicely around the upper arm, and it has to be the right size. So there are a few things to look at, and I think we have brochures out there, perhaps not with home blood pressure monitoring. But if you wouldn't mind, it would be a great help to us. As Lynn mentioned, we're running this May Measurement Month campaign, which is a global initiative across the globe in around 100 countries worldwide. We measure blood pressure to get a bit of an idea what's the blood pressure out there in the population. And I have a slide with a link where you can just log on, measure your blood pressure at home, fill a few questions, and submit. And that will be part of the around 1.52 million blood pressure readings we get every year across the globe to give us an indication, are we traveling in the right direction? We would hope that we at some stage get that down a bit. And this is the campaign run essentially by the International Society of Hypertension, and I'm kind of the lead for Australia and the Asia Pacific region. So we've done really well over the years, and it tells us a lot. So if you are happy to contribute, that would be wonderful. That is the link I mentioned, and again, if you want to have your blood pressure measured outside, that's where to go. So let me sum this up, but I think I've put the message out there already. A healthy lifestyle is absolutely crucial. The metabolic syndrome as such is very common. Those 5 factors, we see them often. Perhaps good for you to know and ask perhaps your doctor what your levels are if you don't know. Is the cluster of these various factors. Healthy lifestyle, the best, cheapest, most effective approach, no side effects. That's the other benefit. And that's something, of course, you get sometimes with medication, but discuss with your health professional. If they prescribe medication, take them regularly. Be honest with each other. It's a team to work on. A big problem in reality is that often we may prescribe medications, and the person takes the script, may even fill the script, but decides, actually I'm feeling quite well, why should I take this? And may not quite be aware what the long-term consequences are. If you have concerns, raise it with your health professional to discuss it, and there may be alternatives. And again, we do a lot of research in alternative approaches rather than medication, for example, to lower blood pressure. There are surgical and interventional approaches are available, but form a good team with your health professional, and then hopefully for you personally, that will make a big difference. This is what we're doing here, just around the corner. Beauty about the Perth Library, it's so close for us, we can just come over and then go back to do our research and work. We do a lot of work on various aspects of health, covering glucose, obesity. Actually, we do a study where we look at how we best treat elevated blood pressure in people who have excess body weight, to really inform guidelines how people should be treated. We do quite a bit of interventional studies where we have catheter-based approaches where we put little wires into various organs to help improve metabolic and blood pressure control. So quite a lot of stuff, but this is in the center of what we're doing. High glucose, metabolic syndrome, and elevated blood pressure. So if you're interested in research, please talk to one of the team out there. Obviously, a big thank you to everybody here from the team who on a daily basis go through the difficult task of doing research, getting funding and just keeping things going, and the fantastic support from the Royal Perth Hospital Research Foundation, who support our research very, very significantly, and that wouldn't be possible without them. This is a very international team coming from India, Sri Lanka, Brazil. Omar is from Dubai, it's just fun to work with these guys. So that's it, not too bad in time. We still have a bit of time for questions. Thank you once again for coming today. Please take the opportunity to have your blood pressure measured, and I believe we have a bit of time for questions. Thank you so much for coming.